There she is.
We can hear you, Mom. You should mute.
Oh, I didn't know that. Okay.
It's like being in the same room with you, though. That's nice.
There she is.
Okay, let's see. I
We can hear you,
think
Mom. You should mute.
Oh, I didn't know that. Okay.
What is happening?
That's part of our live streaming. It tends to repeat.
okay. I think we're ready to go.
Hey.
And we are live streaming at this point. My name is Mark Miller. I'm going to be the Zoom host today. Let's see. I think.
Mom, you should mute.
Oh,
Can you unmute everybody,
Okay.
or except for me?
Yeah.
Okay.
We'll go ahead and do that. Next week, December 6th, UW School of Public Health and COVID-19. We're going to be having Amanda Semanik, Associate Professor of Epidemiology. It's going to be quite timely because she's going to be able to tell us what's happening in Milwaukee with respect to COVID-19. So, Lorraine, if you could go ahead and introduce our speaker.
Sure.
Started.
Okay, thank you. Hi, everyone. Welcome to our forum this Sunday for entitled Care No Matter What. Our speaker today is Molly Lancelot. She's the Community Education Manager at Planned Parenthood in Wisconsin. The Sunday Forum is pleased to support the First Church Share the Plate program, and Planned Parenthood of Wisconsin is the recipient for December. So you'll be able to hear about Planned Parenthood and learn about the programs that they're initiating now. They have been nominated by the youth at First Church, and I'm very proud to welcome the youth in their involvement in our programming. It's rather meaningful that the youth did nominate the Planned Parenthood because Molly is an alum of First Church. She attended from 1990 to 1995, and she was participating in the precursor of our Whole Lives program in her senior year. So we'll learn today of how Planned Parenthood is expanding services despite the exhaustion of the political and COVID upsetting interruptions. We'll listen to Molly, and then there will be time for questions. We'll gather them from chat and through hand raising, and Mark will manage that. So welcome, Molly, and we're glad to have you with us.
Thank you so much, Lorraine and Mark, for setting it all up, and especially to the youth for choosing Planned Parenthood and recognizing that this is a place that they are welcome and a place that we really value youth, their participation, their input, and they're getting the health care that they need. So as Lorraine mentioned, I am a born and raised Unitarian, attending churches in Oak Park, Illinois, and then First Unitarian after we moved to Wisconsin in the 90s before I went to college. And that is where I started my sex ed journey with Our Whole Lives precursor, which was AYS, About Your Sexuality back then. And so now what I do at Planned Parenthood is teach the same kind of comprehensive sex ed to youth. And so I didn't know it was a career you could have when I was a teenager in church, learning it with my dad teaching it and being embarrassed about it. Absolutely. And now I get the joy of telling, straightforward information to young people and adults, and making them squirm as we talk about sex, but also making sure they have access to the resources and the information they need. And so I'm going to talk about Planned Parenthood of Wisconsin and all of our different services, our departments, and the work that we do. the new work that we've launched and how we've adjusted in the time of COVID to make sure that our staff and our patients are safe. So it is our tagline, care no matter what. And so I thought that was an appropriate title for my talk today. This image is called The Goddess, created by some local artists to empower, you know, the strength of especially women and girls in reproductive health as they fight for their rights and access. Now recognizing that all people, regardless of gender, often have to fight for access. And so the mission at Planned Parenthood of Wisconsin is to empower all individuals to manage their sexual and reproductive health. And we do that through our patient services, education, and advocacy. I'm going to play a short video here that just talks about a patient experience. And hope the sound comes through.
My name is Lori. I'm a busy mom from Wisconsin. I like being from Wisconsin. It's beautiful and just a really great place for a family to grow up. As a new teacher in a Catholic high school, I was underinsured. And so for my preventative care, I used Planned Parenthood. I go there every year for my exam, my screening, and my grandmother died of cervical cancer. So it was very important that I was screened. And then one day I was having these horrible pains in my lower abdomen. And I called my doctor, Planned Parenthood, and told them. And they got me in that same day. And they did some preliminary tests and said, yeah, you need to get an ultrasound. Found out that I had tumors and cysts in my ovaries and that it was a health emergency. They acted quickly. It was within the span of maybe 10 days. And they were able to save a half of an ovary. And that was enough because I was able to have children. So I'm grateful to Planned Parenthood. I feel like it's my duty to stand up and show the gratitude that I have for Planned Parenthood when they are facing their struggle, because they help me through mine. People are starting to speak out and gain speed and bond together, and we need to keep using that influence to get our members of Congress to listen to us before they act on something that I think we'll all regret.
Just as I'm transitioning back to the PowerPoint, you can see that YouTube has a lot of videos from Planned Parenthood. So there's a lot of information that people can access, including information about methods of birth control, or how do you get tested, or how do you talk to partners. So it is a great resource. I recommend searching Planned Parenthood on YouTube and finding some of those videos if you have interest and information you're looking for. All right, so let's get back to the slides. So I just want to explain Planned Parenthood is the oldest, largest, and most trusted reproductive and sexual health care organization in the world. Planned Parenthood Federation of America, which started in New York 104 years ago, as a birth control access and family planning center, has grown into the Planned Parenthood that we know of today. But there is a difference between the Federation and the Planned Parenthood of Wisconsin that you know. So I just want to make sure we understand the difference between the national and the local levels. So the Federation, which always makes me feel like I'm talking about Star Wars when I talk about the Federation, but it does, it is the umbrella organization for 49 independent Planned Parenthood affiliates. And we all operate with boards and budgets and all of those things that are independent. And throughout the country, we have over 600 health centers. in those affiliates, and there is a presence in all 50 states. That doesn't necessarily mean there's always a health center in all 50 states, but often there's at least some political arms in all 50 states. And then there's also a global branch of the Planned Parenthood Federation that works in Africa and Latin America to provide resources, information, and support. So the Federation is a very large umbrella organization, and this is the map of the United States, and these are the affiliates, and these change pretty frequently. But as you see, Wisconsin is a single state affiliate, which is kind of interesting and lucky because the borders are very clear. Here in Illinois, there's a little teeny piece of Illinois near St. Louis that is a separate affiliate, and all of Illinois is another affiliate. And here we have the North Central states, which are 5 different states mushed together, the Rocky Mountains. So you see the affiliates contain different pieces of different states, sometimes whole states, but Wisconsin is still one of the independent affiliates as one state. And we actually have quite a reach within our state that is pretty significant. So I'm going to show you some of that. So just for your information, throughout the country, Planned Parenthood provides 4.5 million tests and treatments for STDs each year, sexually transmitted diseases. 1 in 5 women in the United States has visited a Planned Parenthood health center at least once in her life. And that is something that we're known as women's care centers, but we really are trying to make it clear we serve anyone of any gender. We do have men's health resources, and as I'm going to talk about later, we have services for trans and gender nonconforming individuals. And so, you know, we want to get that word out that really anyone can access care with us if they have a reproductive or sexual health question or problem or need. Planned Parenthood provides family planning, counseling, and contraception to 2.1 million people each year. And 1 in 3 women in the United States has had at least 1 abortion in their lifetime. So that's a pretty common procedure, whether we like to talk about it or not. And then Planned Parenthood throughout the Federation has 43,000 employees nationwide. So now we're going to drill it down and look a little closer in the state of Wisconsin, and for the Wisconsin affiliate, PPWI. We are made up of 4 main parts. We have our patient services team that run the clinics and do all the healthcare. We have our education team that I'm part of, that we go out and are one of the forward-facing departments where we educate our community and our state around our services, how to access them, as well as just sex ed in general. We have our administrative support team. Of course, we couldn't operate without IT and HR and billing and all of those folks that do all the support behind the scenes. And we have our public affairs department. And so that is the political arm that does advocacy and encouraging people to be involved, especially locally, with what's going on in the politics for the people making decisions for all of us. I have another short video clip that just gives you a better snapshot of some of the people that work throughout the state to work at Planned Parenthood. So I'm going to play that one real quick. I will turn on captions.
Planned Parenthood is the place I was supposed to be. This is what I was born to do. I've always wanted to work with people and help people and make their lives better, or even have some type of important impact in their daily routine.
Even if it's just changing one patient who comes into our centers to give them the care that they're needing. Those are ripples of hope that we're providing to that patient, but the community as a whole.
there are so many people who don't seek medical care because they don't have insurance or not enough money to be seen by a provider. And that really doesn't matter when you come to Planned Parenthood. We'll see you, whether you have $1 in your pocket or $1 million in your pocket. So we provide awesome care to any and everyone, no matter what your financial state is.
In a very poor county that doesn't have a lot of resources, a patient came in, she got her yearly exam done, PAP done. Turns out that she had cancer. Just a week later that we had diagnosed her with cancer, her sister came in and said, I haven't had a PAP before, I'm really scared. My sister was here last week and got some bad news. But we were able to be there for that family and actually be the first type of healthcare that they've been able to get in over a decade.
13 years ago, I moved to the United States. And like many other immigrants, I didn't have health insurance. I did not want to get pregnant right away, but I couldn't afford $120 per month for a pack of pills. The only healthcare provider that was able to help me was Planned Parenthood. Thanks to Planned Parenthood, I finished college and I became a mother when I was ready to become a mother. Every time I teach a girl about birth control, I see myself 13 years ago. And working for Planned Parenthood gives me the opportunity to give back to an organization that did so much for me. And I know Planned Parenthood.
Oh, goodness. Okay, I don't know why that stopped in the middle. We're just going to move along. I think that was able to provide a good snapshot of some of our employees and why it's so important when we work at Planned Parenthood and do the work we do to reach the communities and the people we do, and especially folks that haven't had access to healthcare, that are immigrants, that are young teenagers that just are trying to figure out how to take care of themselves, maybe without a lot of support or guidance. And so a lot of us work at Planned Parenthood because that's really important to us. So, okay, health services in Wisconsin, we're going to show you some specific numbers. We have 24 health centers throughout the state, and that's quite a lot for one state affiliate. Some places only have 2 or 3. We have 24 throughout the state. I'll show you a map of where they are. We also have a nurse call center with centralized testing follow-up, so folks can call in and talk to medical providers without having to get through to the clinic they visited. We do community partnerships, especially in areas where we are trying to grow our base, so that we are making referrals to agencies that we are familiar with and they are familiar with us, and really building our reputations in some areas where maybe we're not as well known or well thought of as it may be, depending on people's personal beliefs. And then, of course, we have our patient services administration team, which work to make sure everyone is trained and up to date and has the latest medical guidance that they need to do their jobs well. Here's the map of the 24 health centers in the state. So we have quite a few in our larger metropolitan areas, of course, but we do move all the way from the east to the west of the state and about halfway up the state. Our most northern health center is in Eau Claire. And right now we have 20 health centers that are family planning services only. So that's doing things like pap smears, birth control, prescriptions, STD testing and treatments, those sorts of family planning services. We have one site that does those services plus colposcopy. So that is our site in West Allis on Lincoln Avenue, Lincoln and Highway 100. So if somebody had an abnormal pap and needed to be screened further for cancer, that's where they go for a colposcopy in West Allis. We have one site that is family planning services plus medical abortion care. So medical abortion is the pill version of an abortion, and that can be received at our Sheboygan Health Center. And then 2 clinics that offer medical and surgical abortion care only, and they don't do the family planning services right now because of the high demand for abortion care and the fact that there are only 3.5 abortion centers in the state. So there's one in Madison that we run. There is one in Milwaukee on Water Street. And then there's a privately owned abortion clinic in Milwaukee on Farwell. So that's closer to the church that you guys might be familiar with protesters out there and things. That's Affiliated Medical, and that is a privately owned abortion clinic. Though it was started by one of our doctors after they retired, recognizing the need for that access to care in our state. So these are all of our family planning centers throughout the state, and a lot of access to care. And now with COVID, even more so with telehealth available. So I'll talk more about that. Here's a little breakdown of who our patients are from our latest annual report, which was 2018-19. You know, what are the number of encounters we've had with patients, the race and ethnicity of patients, the identified gender of patients, their ages. So you'll see that the ages tend to be in the 20s. I think a lot of people may assume, and even into the 30s and 40s, may assume the majority of our patients are young teenagers, and that's not actually the most of our patients. But we do have a high level of poverty in our patients, and so we do offer making sure that people can access funding and can get reduced cost services, or can be signed up for things like Badger Care and family planning only services to cover their healthcare needs. And of course, with the Affordable Care Act and people having access to different types of health insurance, we do take all types of health insurance and can run people's services through any of those. So the vast majority of people come to us for birth control and STD testing. We also do a large number of HIV tests, pregnancy tests, cervical cancer screenings. We have abortion care, breast exams, and colposcopies. So this is just a breakdown of some of the types of services and where our numbers are for where our patients are coming in. Using health services at Planned Parenthood of Wisconsin, you're able to do your scheduling. Right now, we've reduced our walk-in scheduling because of the COVID-19 restrictions and wanting to have fewer people in locations. But you can do an online appointment through our website, or you can make a phone call and make an appointment. And then at your visit, the check-in may be done over the phone, again, trying to reduce the number of people in our physical sites. And so the check-in and some of the intake questions can be done via the phone. And then if you need a physical exam, you can have a physical appointment. And then there's, you know, some exit interview things. And then the discussion of payment, whether someone is a self-pay client, whether they have insurance or Medicaid and FPAS. So as it says, the visit may take place over telehealth or in person. And telehealth is done similarly to this. You can have a screen, you can see a person. And so whether could be just a phone call with a voice, or ideally, if people have access to a screen and a Zoom or something along those lines, they can see their provider. We have the standard of keeping our patients healthy and standardizing, normalizing different types of tests. So 80% of our patients get a yearly chlamydia test. We encourage that. We make that a part of annual care. 80% of our patients get a pap smear in the recommended time frame, and those have changed since even since I became a person needing to access those types of exams. It used to be every year. Now it's every 3 years, depending on your history. So people are getting those done as recommended. 72% of our patients use an effective birth control method. So those are one of the types of birth controls that are considered to be 95 to 99% effective when used correctly. And 69% of eligible patients use our quarterly contraceptive kit, which is a mail order service where we can mail you 3 months of your birth control method, along with condoms and emergency contraception, so that you don't have to physically go pick up your birth control prescription. And that's really excellent if somebody is going to a clinic and then going away to college and may not have access to their health center every 3 months or as easily. So we do have the quarterly contraceptive kit. The things that have changed recently that have been enhancements to our health services are adding early pregnancy complication services. So when folks are having abnormal bleeding or pain in pregnancy, we can diagnose and treat miscarriage as well as dangerous complications such as ectopic pregnancies. We do preconception and postpartum care and referrals as needed. We have endometrial biopsy, so that's a uterine cancer screening when certain patterns of abnormal bleeding are present. Polyp removal, so removing growths from the cervix and sending those to pathology to rule out cancers. HPV vaccines, making sure that any individual who is eligible for all genders can get a vaccine to protect from 9 different types of HPV that prevent cervical cancer and genital warts. And then we also do syphilis evaluation, testing, and treatment. So that's an expansion in our services. We used to do perhaps more referrals for these types of services. And the big one that really we're very excited about is the access to gender-affirming care. In late October, we launched hormone replacement therapy in all of our health centers, available through telemed right now. So we can see patients who are 18 or older. Right now, we are not seeing individuals under 18 for this service, and that has to do with billing and things like that right now. Our in-person services are in our La Crosse and Eau Claire health centers. So the nursing staff there are the ones who are trained and can see folks face-to-face if they're in La Crosse or Eau Claire. But because of telehealth, anyone throughout the state can receive and talk to those clinicians in La Crosse and Eau Claire to access gender-affirming care. And then the labs that are needed for hormone replacement therapy can be accessed at your local Planned Parenthood. So if you're in Milwaukee, you can make this appointment, talk to the clinician in La Crosse, go to the Wisconsin Avenue Clinic and have your blood draw, and then get your prescriptions at the pharmacy that you choose. We can bill insurance and Medicaid. Currently, Medicaid doesn't cover the office visit at Planned Parenthood because we are a reproductive health service clinic, and gender-affirming care is not considered reproductive health in the insurance laws. I don't know the exact specifics. I know that Medicaid will cover prescriptions and labs and everything but the actual office visit at Planned Parenthood right now. So that is something we're working on, figuring out funding for individuals that don't have, that have Medicaid and need help paying that office visit. We use the informed consent model of care. So that means that if you come in looking for gender-affirming hormone therapy, we assume that you know that you need it for yourself, and you know yourself better than anyone else. And therefore, by explaining the benefits and the possible side effects and problems with it, you can make that informed decision to access those hormones if that's what you're seeking. We also are happy to have increased access around the state. So especially outside of Madison and Milwaukee, where there are other health centers and big medical providers where you can access some of this type of hormone therapy, being able to access it in La Crosse, Eau Claire, Racine is a big improvement. We have a lot of appointments right now where other providers may have waiting lists because we are newer to the service and don't have established patients right now. And we can also assist with letters for name changes, gender marker changes, prior authorizations through insurance, and all of those things that go into some of the needs that folks seeking gender affirming care may need. So that's an exciting new service. And while currently our providers in Eau Claire and La Crosse are trained to do it in person, it will be something that once we've gotten our feet under us and are doing it well and have a smooth way of adding this into our services, we will be training all of our clinicians so that there will be face-to-face and in-person opportunity for anyone at any Planned Parenthood in Wisconsin at a later date. So that upcoming training is a few months off while we adjust to new services and a new way of living in COVID-19. So that's now what's changed during COVID-19. We have had a reduction in the number of appointments we can take and the number of people that we want in our health centers at any one time. So that's for safety. We do COVID screening, temperature taking, masks are required for all patients, and don't have visitors allowed at appointments right now. And that does include abortion care, which can be really challenging for patients who need support, but that's reducing the number of people in our health centers. We do our pre-screening by phone for in-person appointments. We can do mail order STI testing. So we can mail you a kit, you can self-swab and mail it into the lab. So you don't even have to come in for that service. We also have prescriptions for birth control and UTI treatments you can get through our PP Direct app so that you can access those without having to come into a physical center. And we also have curbside pickup of birth control and other medications, as well as that mail order service I talked about. And so telemed services for many appointments are available. Obviously, if you need a pap smear or some other kind of exam, you can still physically come into one of our centers, but as much as possible, we're doing things via telemed so that we're reducing that contact with people and keeping everybody safe from spreading the germs. Now I'm going to move into talking about our education and training programs. And I just want to check on time. Mark or Lorraine, I don't know if you can let me know where I am for how much time I have left before we get into our question answer.
I would say sooner the better.
Okay. All right, I'll go quickly. Our education and training programs offer school and community-based education in all the types of sex ed topics that are covered in the Unitarian curriculum. We also have parent workshops if people need help with talking to your kids about sex. We offer different kinds of professional training. We have a conference that we run that got canceled in March, and we're going to run virtually in January. And we do other kinds of technical assistance for schools or clinic community-based agencies. We also have a resource center, which is like a library that anybody can access for books about any type of sexual or reproductive health, as well as curriculum, videos, things like that. If you need access to those, it is a lending library. We have youth educators that are young people who can talk with our patients while they're in the waiting room about contraception, STIs, communicating with their partners. This has been put on hold because of COVID-19 restrictions. Normally they would be available at our Northwest, which is near Midtown Health Center, and our Mitchell Street Center on the south side. Those are the two Milwaukee centers, or those are two of our Milwaukee centers. We also have a sex ed texting program. If anybody has a question, they can text Safer Sex to 69866 and get a response from an actual person in English or in Spanish about whatever sexual or relationship question they're having. And often they get referred to one of our medical centers if it's a clinical question, or perhaps websites to read more if they have questions that they're trying to figure out. So that's a nice way to ask a question anonymously. We have a Spanish language program that is our Promotores de Salud, which are health promoters, and they are actually throughout the state: Milwaukee, Madison, Delavan, Platteville, Lake Geneva. We've got some up in Green Bay and maybe La Crosse now too. And they teach a curriculum in a home setting where outside of COVID, they would be able to have meetings with a host and several of her friends or his friends to discuss different topics around sexual and reproductive health and advocacy, civic engagement, things like that in the Latino community. During COVID-19, we have not been in schools. This is me dropping my condom and woody bucket down the stairs at a local high school last year. I haven't had the opportunity to do that this year, luckily. We've been doing video and live lessons taught virtually over Zoom and supporting teachers who are facilitating health. And our promotores actually really did a lot of work around calling past hosts and party attendees to talk about COVID and what support families needed, as well as voting registration. So those relationships formed in education opportunities really helped with some of the movement around supporting communities through the election and the census and the pandemic that we're all living through. The last piece of our agency is public affairs, and this is the political side of things. And so the advocates here work for legislative and social climate change in support of reproductive health, equity, and other social issues. So they do a lot of work in lots of different ways, from grassroots education and outreach to election work and lobbying. They operate under a 501c3 or a 501c4, depending on if they are endorsing candidates on the C4 side or just doing nonpartisan educational work on the C3 side. We just have to be clear about the differences here. I was going to speak a little bit about Roe versus Wade and the concerns in the Supreme Court. Currently, we have 17 different cases that are one step away from going to the Supreme Court, and they are challenging Roe. And right now in Wisconsin, we have a criminal abortion ban on our state laws that if Roe was reversed, our state would criminalize abortion. We have other types of laws that are restricting access to abortion. So currently in our state, we have a 24-hour waiting period for abortion. There's a 20-week abortion ban, a required ultrasound, and funding through insurance or Badger Care is only in cases of life endangerment, rape, or incest. So accessing care is difficult financially. So that's something to be aware of. We're still trying to figure out what's going to happen now after the election with a new president. We're hoping for positive changes on reproductive health and freedoms, but we don't know the balance of the Senate yet, and that can make a difference. Depending on how the runoff elections in Georgia go, we won't know until early January. And in our own state, we know we have a friendly governor, but we also have legislative control, largely on an unfriendly side. So there continues to be a lot of action and election work and things done virtually over texts and calls. I know all of us received 1 million text messages around voting this past November because people couldn't be out door knocking because of COVID. So engagement with supporters has turned virtual, encouraging people to educate themselves locally around the issues that are affecting and what their local politicians are making decisions about. And then relationship building is really important all around our political work. So if you want to know more about the political side, you can follow us on Twitter, Facebook, or Instagram, PP Advocates of Wisconsin, or go and sign up for our email alerts. You may receive emails and get things like this already from the Federation, but this is for really the local information, which affects those of us living here. And I will stop, offer you my email if you have specific needs or questions you want to ask, and open up for other questions that might be coming in on the chat. And thank you so much.
Yes, take a look at the chat.
Yeah, I'm trying to find it again. There it is. Okay. Okay, so hopefully the question of virtual visits has been answered. So people in northern Wisconsin can make an appointment and then do virtual visits. If they needed a physical exam for something, then they would probably have to figure out a way to travel to their nearest health center. Some folks in northern Wisconsin actually go up to Minnesota or Michigan for access to Planned Parenthood because those are closer than where some of our health clinics are, unfortunately.
I can help you.
Yes.
There is a question that one wonders if you still need to have services from organizations like First Church to help protect patients, but that could be a COVID-related question.
Yeah, so the clinic on Farwell is not a Planned Parenthood clinic, so that's completely not anything I can speak to as to whether they still need escorts. Our abortion clinic now on South Water Street has a private parking lot so that patients don't have to, be on the sidewalk where protesters are. And we do have protesters, but so that type of escorting isn't necessary at our health centers right now. The Farwell is a privately owned abortion clinic, so that would be a question for their staff and owners. What percentage of our budget are supported by personal donations? I don't have the percentage off the top of my head. I know it is available through our annual report, which is on our website, but because things have changed with funding from the government, I know that we really depend on personal donations and support from people who want to make sure that our access and our care is still available in these times. So that is really important that we continue to get personal donations as well as some grant funding and some insurance reimbursement for healthcare.
Molly, I did read through the next question. Can I just narrow it down for you?
Sure.
The concern was that was the Supreme Court and Roe versus Wade. And the concern was that since there are a good number of women who seek abortion services at Planned Parenthood, why don't we hear more from that angle of the question? We hear mostly from those opposing the abortion. So can you speak to that? Why don't we hear more from those who have had services and need them and can tell the importance of that?
Yeah, I think the reason we don't hear openly from the 1 in 3 people who have had an abortion in their lifetime is because of stigma. There's a lot of judgment. There's a lot of fear and guilt tripping that goes on. And even people that select abortion as the best choice for themselves and their families at some point in their life may not feel safe discussing that with the majority of people or having that be public knowledge. And so we try to do a lot of work to destigmatize all sorts of sexual and reproductive health care. But that's part of what we're doing is by saying 1 in 3 people with a uterus have had an abortion. That's a statistic most people don't know. And if you speak openly about it, you may hear from people that you didn't know in your life and really make that something that is so common that we shouldn't be ashamed to talk about it or to support each other for it. And those discussions are being had, to our supporters and to our political partners. And there are some campaigns nationally called Shout Your Abortion and things like that that are trying to be more public about this because it's healthcare. It shouldn't be shameful, and it is something that people should be able to access without roadblocks, but that's just not the way our country operates a lot of the times. And so that is the challenge and why we do these sorts of talks and try and get that word out. I think it's just stigma.
I'll just step in one more minute. I'll just step in one more minute here. Molly, can you, there. So
I just
remove
saw
the
that one, sorry.
screen. And then the other one was a quick question about our closed captioning offered through your tele meetings for those who have hearing disabilities. And then I'll let it go to people who raise their hand.
Yeah, that's a great question. I know we do have things for people who speak different languages, so I would have to check. I'm sure we do have captioning access, because that's just part of making sure everyone can access healthcare. I don't know what services we use that way, so I would have to look into that for you. And I'm happy to follow up if you want, BJ, to know. Yeah, okay, I can certainly follow up. Do you want to take my email and pop me a message, and then I'll let you know.
Yeah,
and then
your email, so I'll email you.
Great. How much government funding has been lost? The biggest hit that we got 2 years ago was the loss of Title X funding from the federal government. And so that means that the funding that allowed us to make services free for the most vulnerable populations, the immigrants who might be undocumented, the teenagers without access to their social security numbers, that was Title X funding that allowed us to make all of their services free. And because of that, federal funding was taken away from anyone who provides abortion, even though none of that funding ever went towards abortion care. It was deliberately created to take it away from Planned Parenthood. That just means that we have to work on a sliding scale fee basis. Some people will have to have payment plans because we lost, it was close to $3 million in our budget in Wisconsin. And then across the federation, some Planned Parenthoods had to close clinics and let people go because that funding was really important, the Title X funding, which in our state has now gone to state health departments who don't have the capacity to do reproductive health care in the same way we did. They can offer some services, but health departments are doing lots of things. And we know right now health departments are really swamped with COVID response. And so accessing birth control and STI testing through health departments could be a challenge. In Milwaukee, we have a partnership with the health department that if they have reached the peak of who they can test for STDs at their Keenan Health Center, they then refer patients over to our Northwest clinic. So they don't have the capacity to meet as many people at the sexual and reproductive health care needs as our city and our state require. So yeah, government funding was important, and we are still operating without it, and we have found other ways to support ourselves and to increase our donor base, because that's really where we have the unfailing support of individuals who know the importance of people being able to access healthcare. So any other questions? Oh, BJ?
This is BJ again. It sort of feeds into what someone had asked in the chat. Are there any instances still of people protesting in front of your centers and patients needing protection to enter, or just support to enter?
We definitely do have protesters every single day in front of both of our abortion clinics. Absolutely. Sometimes we have protesters in front of our Lincoln Plaza place where we do the colposcopies, because it's on Highway 100, a really busy street, and people like to get cars to honk at them and things. At this point, our security head believes that bringing more attention and having supporters there arguing with the protesters creates a bigger problem and makes things more difficult for patients to get through. If the two sides are standing there yelling at each other, that's not, a productive way to keep patients feeling safe with larger groups of people getting rowdy. So for the most part, we give our patients the heads up. There will be protesters. They're not allowed to approach you or touch you. Once you're in the parking lot, you're on private property. And all they can do is shout from the sidewalk. And that's how it's been going for the last few years. It changes politically, and as the federal support of politicians changes in the White House, sometimes the protesters get larger and more aggressive or louder. And so sometimes that changes with the need for support. But I would say the better way to support and counteract our protesters are to speak with the people you know and love about the truth of our services, the access people need, the reason people might choose abortion care, and to not worry as much about yelling at the people who are standing outside the clinics, because they're going to do it. We aren't going to change their minds, and making sure our patients can still get the care, have the funding to get the care if they don't have access to insurance or money that way. That's really where we're focusing our efforts for the most part. But yeah, go ahead.
So if that should change, be signing up for the email list with the PPA would be the best way to go. I also remember when you needed protection some years back, we were carefully trained to stand, protect the door, and not say anything.
Right.
And you were escorting people, and that was the best thing to do, because you're right, you're not changing. It was just be silent and create a lane for the patients to walk in. So, okay, thank you very much for everything you're sharing.
Thank you, BJ, for your experience. I think we're about ready to close. Would you say so, Mark? Is there one more question or one more comment you'd like to make, Molly?
Oh, I see Dennis is raising his hand.
Okay, one more question then.
Yes, I'm wondering what level of psychological work you do with people that come in like at age 18 and so on for trans meds and so on. It seems like it's such a huge decision to start changing hormones and physiology and that sort of stuff. And a lot of kids, I think, at 18 yet aren't that sure of who they are even. And especially if the person might have autism or some personality issues, it seems it's quite a drastic step to actually make those physiological changes. So again, the question is, how do you have some idea of how deep the psychological workup is before you would start providing or give prescriptions to those kind of hormones or changes?
Sure. I do know that our intake meeting for people seeking gender-affirming healthcare is much longer than our first-time meeting for most other patients, because there is an amount of history that needs to be taken, and those conversations around, what are your goals for your gender care, and what are your concerns. We do client-centered communication, where we really expect the client to be the expert of their own lives and their own bodies. And all of the hormonal prescriptions are completely reversible. So if somebody were accessing hormone care, thinking that was the direction they wanted to go in, and change their mind, they could stop it and its effects would reverse. So it's not perhaps as permanent as some people might be concerned about, like a surgical transition could be, but there are a lot of conversations going on. The informed consent model means we don't require a letter from a psychiatrist. We don't believe there's a mental disorder. People know their gender and they make this decision having thought of it for a long time. And so those conversations are had, and then the patient is trusted to make the decision that's right for them. If they want access to mental health care, we absolutely will make referrals to therapists or counselors if they feel like they need that, or if they need to talk a little longer with someone before they decide to access that medical care. But there isn't, any kind of psych eval or anything that we do for people accessing gender affirming care. That's not within best practices. So I think some of this is just needing to maybe understand the medical side of it, and also that gender identity is something that people don't just decide, oh, I'm going to go get some testosterone today, because it's usually something that's been well known and thought about and processed for years before they're actually old enough to access it. And so people accessing it don't usually change their minds or decide that was the wrong thing, although they might need to adjust levels of things depending on what their goals are in their gender journey. That was a good question. Thank you for asking.
Thank you.
Okay. Molly, thank you so much. I think this is a good time to end. So we'll give you a wave.
All right.
Thanks so much.
Thank you, everyone. Do get in touch if you have additional questions.